Hey everybody, happy Friday. I wanted to film a video about blood sugar and diabetes. Now, obviously, blood sugar is quite important and actually serves as your main fuel for your muscles and your brain. So no wonder it's very tightly controlled. Low blood sugar will cause fatigue, dizziness, anything from passing out to being in a coma. And high blood sugar over a certain level is actually quite toxic for your blood vessel lining, the endothelium. High levels of blood sugar over time will have an impact where you have almost like an increased stickiness of your blood vessels, and it will accelerate the deposits of cholesterol, which can form atherosclerosis. So much so that diabetes is considered a major risk factor for cardiovascular disease, and people who are diabetic are considered at high risk of having a cardiovascular event, which typically means over 20% chances of having a cardiovascular event within a 10-year span. And that's why diabetes has to be taken seriously, because you really don't feel it unless your sugar is very low or very high. People in the middle will typically not have much symptoms, but the damage will be happen slowly but surely over time, and typically lead to cardiovascular event. It can also cause damages to the eye. It's the first cause of blindness and of foot amputation because of the impact on small blood vessels, and one of the first causes of kidney failure and dialysis. So the thing is with blood sugar and diabetes is we can typically see it coming. So how that happens is that, first of all, your pancreas produces insulin, and insulin acts on your muscles and on your liver and all cells all over your body to store energy. So insulin is a storage hormone. When you take energy, the insulin when you eat carbs, fat, or protein, insulin gets produced and wants to put these macronutrients and their energy they contain inside of cells, either to be stored or used. So what happens is that if you eat excess energy over time, the energy will be stored either as glycogen in your muscle and liver, or as fat in your subcutaneous tissue. Subcutaneous meaning underneath your skin. For some people, genetically, they'll accumulate their fat in their belly, in their thighs. Some people will be in their butt. But just kind of keep in mind that our maximum capacity to store subcutaneous fat is determined genetically. So what happens is that we all have a personal threshold on where that fat storage is maxed out. So let's just say that my fat storage maximum capacity is 20 pounds. So let's say tomorrow I start eating excess calories and I gain 20 pounds. Those 20 pounds will be stored underneath my skin in my fat storage. And what will happen is my 21st pound, because 20 pounds I've hit my max storage capacity, the next pound of fat will actually be dispersed and stored inside of my muscles, inside my liver, and inside my pancreas. When that happens, okay, the impact that insulin has is slowed down or impeded. So firstly, fat inside your organs is not healthy. It's called visceral fat, and visceral fat is not only inflammatory, but it actually negatively impacts the function of that organ. So if your muscles contain fat because your subcutaneous tissue storage has been maxed out, your muscles will not be as responsive to insulin and unable to use that energy. And so the energy and the glucose stays in your bloodstream. Also, same thing goes for your liver and your pancreas. The issue is twofold with visceral fat, where when you get fat accumulation in your liver, in your pancreas, and in your muscles, the fat inside your pancreas actually impedes the production of insulin. That's where insulin comes from, beta cells in your pancreas. So not only does fat inside of your liver and inside of your muscle impede the effect of insulin, fat inside your pancreas impedes the production of insulin, and your pancreas is not as efficient and able to produce the insulin levels that you need. So what happens is that you get insulin resistance. Insulin resistant is the first stage where we'll see your blood sugar slowly creep up. Then after that, once you get past a certain threshold, your blood sugar gets higher and we call you pre-diabetic. And when your blood sugar gets too high, you develop type 2 diabetes. Now, there's a blood marker that we call A1C. A1C is a blood marker that indicates your average blood sugar in the last about 100 days or 3 months. Now, that blood marker should be measured every year so that we can see it trending. So I'll give you an example. If someone has a blood sugar of 5.1 on their A1C, and in 2 years from now it's at 5.9, even if it's in the normal range, you've gone up considerably, and you've probably developed insulin resistance if you've gained weight over that time. Now, that fat is likely stored in your liver, in your pancreas, or in your muscles. If your blood sugar goes from 5.9 to 6.0, at 6.0 we draw a line in the sand and we say that you're pre-diabetic. Now, the chances of being diabetic within 5 years of being pre-diabetic is about 20%. So from 6.0 to 6.4, you're considered pre-diabetic, and at 6.5, another line in the sand, you're diabetic. From 6.5 to 7.0, we say that you're a well-controlled diabetic, and at 7.0 or more, we tell you that you're a poorly controlled diabetic. Now, it's not like that 5.9 is normal and then 6.1 danger. Keep in mind that it's always a spectrum, meaning that the risk of damage to the inside of your blood vessels or your endothelium is progressively higher as your blood sugar gets higher. So at 5.9 and 6, you slowly get up. At 6.5, the curve really starts to go up, and at 7.0, it goes up exponentially. So the higher your blood sugar, the more dangerous it is. It makes your blood vessels inflammatory and more sticky, and then the cholesterol that circulates in your blood vessels form atherosclerosis much easier on blood vessels that have high blood sugar circulating in them. Now, just kind of keep in mind that the danger related to blood sugar is related to, number one, the level at which it is high, so a very high level, and also to the length of exposure. Same thing as basic toxicity. The dose makes the poison, and the dose equals the level and the length of exposure. So having a medium increase in blood sugar, but for 20 years, can be as dangerous as having a high, very high blood sugar, but for 3 to 5 years. Now, that's why I try to make sure my diabetic patients are aware of that, because for a lot of people, they don't feel their blood sugar being high, and they don't feel any sense of urgency to act. It's very easy to become or to minimize the impact of your blood sugar on your body when you're not feeling sick at all. But the damages are being done under the microscope, under the radar, and will absolutely show themselves typically within 5 to 10 years. Now, I've seen patients say, oh, my blood sugar is 7.8 on average. That's not that bad. I was 10.2 last time. It's dangerous no matter what. If you're over the limits, it is dangerous. Now, if we're measuring your blood sugar directly through a skin prick or through a blood test, and we measure your blood glucose concentration, you want to keep it between 4 and 6, right? And over 7 while you're fasting diagnoses you with diabetes, and over 11.1 while you're on a random test after a meal, for example, will diagnose you with diabetes. If we're talking about hemoglobin A1C, the blood test that people get every 3 months that measures average blood glucose, that's different. It doesn't measure blood glucose. It measures a protein where the glucose circulating has deposited on the protein, and we offer a percentage. So it's not the same thing. So telling you that your average blood sugar A1C is at 6.8, that doesn't mean that your blood glucose is 6.8. That means that there's 6.8% of your protein that's glycated, and that actually is probably equivalent to a average blood sugar of 7 to 9, even higher. So kind of keep in mind that the most important thing is not only just to check your sugar once in a while, is to see trends over time, because the first stage is insulin resistance, where your fat storage underneath your skin has been maxed and your fat is getting stored inside your organs, your liver, your pancreas, and your muscles. And after time, after a certain amount of fat has been stored in your organs, you're going to start to feel insulin resistant. You're not going to feel it. You're going to start to be insulin resistant. Your blood sugar will slowly creep up. And after that, you'll develop prediabetes and then diabetes. So we can see it coming. Just kind of keep in mind that the most important risk factor for diabetes is obesity, but genetically, if your fat storage capacity underneath your skin is very high, that would explain why some people can have morbid obesity but not be diabetic, and some people have 10 pounds of excess fat and they become diabetic. Maybe their fat storage was underneath their skin was maxed out at 8 pounds, and at 9 they started accumulating that fat inside their organs instead of inside their skin, and the organ dysfunction followed shortly after. So the most important thing to understand is that visceral obesity, or fat being stored in your organs, is very dangerous and a high risk factor for metabolic dysfunction, diabetes, hypertension, high blood levels of cholesterol, even cancer, and fatty liver, like we already discussed. You do not want to be storing fat inside of your organs, and if you are, it means that your fat storage underneath your skin is already maxed out. The good news is that once you lose weight, that's the first type of fat to go away. It actually is the first fat that we will lose, is the fat inside your organs. So if that offers you a little bit of kind of reassurance, is that if you lose fat, is going to be that type of fat that you're going to lose first. You might not see it in the way you're feeling or in your belt size, but we're going to see it on your blood tests. So just kind of keep in mind that obesity is the first risk factor, and obesity is caused by excess energy intake over time. Most important thing to consider is just kind of increase your intake of whole foods. They're typically low in calorie density, and in terms of weight loss, nutrition is much more important than exercise. But in terms of longevity, nutrition doesn't outbeat a good exercise routine. So do both. Try to do both, and the benefits are dose dependent, meaning that it doesn't need to be from 0 to marathons. Just walking a few times per week is great for longevity, and just adding more plants on your plate will diminish the calorie density of your meals, increase health for sure, but also lead to more sustained weight loss, which will lower the amount of fat that you store inside your organs, the amount of what we call visceral abdominal fat, and will decrease insulin resistance. Insulin resistance will get better. Your blood sugar levels will get lower and back to their normal range, where they're able to fuel your life but not cause damage to the endothelium of your blood vessel lining. Right on. I hope that makes sense. Let me know if that makes sense. Let me know if it doesn't. Let me know if there's any diabetics here, and even anyone who has managed to reverse their diabetes or their prediabetes or their insulin resistance using lifestyle change. Eat more plants, move more, and typically things will start to fall into place. Cool. All right. Have a good weekend. Happy Friday. Peace out.